So using a Franklin ball, something with a bit of give in it, about the size of a grapefruit. First of all, placing the ball of the foot over the ball, and you're going to roll across the ball, just trying to separate the toes and roll each toe over the ball separately, from touching the bigger toe on the floor if you can, and then touching the little toe on the floor as well. So do about 6 to 8 of those. Then we're going to move on to the heel. So the ball on the heel, and from there, rolling side to side. So we're trying to get some ankle range in this one. You can go as far as you're comfortable. Just rolling side to side again, 6 to 8 of these as well. And then put the ball under the arch, and you're just going to put a bit of pressure through that arch. So we're rolling through there, just compressing the soft tissues. 6 to 8 of those. And then you can start to put more pressure through as you're comfortable too. Then we're going to roll through the whole foot from the front to the back, keeping this foot on the floor so you've got quite a split stance. 6 to 8 of those. When you're comfortable, if you get comfortable, you can just come up off the ground a little bit with that back foot. Even bring the foot forward a little bit as you roll forward on the ball. So it's really going to release the fascias through the foot and open up the ankle and the bones and joints in the foot. So just place the feet side by side and just feel the difference. Do a few calf raises, a few hops. You'll notice the difference side to side. It's a really good one to warm up the ankles before you go for a run or do a workout. Using a peanut kind of roller, if you've got something with spikes, without spikes. If not, you can use 2 tennis balls, either duct tape them together or put them in a sock, tie up the sock, and then you'll have the same kind of shape. Any of that is good. So you're going to put the Achilles tendon right into the lower part of the peanut, and we're just going to roll through the Achilles. In particular, we can roll the calf separately, but we're going to focus on the Achilles for this one. So just having the foot in neutral, roll through there, get the blood moving. If it starts to go a bit off center, just bring it back. And then we're going to push down through the Achilles if needed. If it's too sore, then you can back off and you can just do it without the extra pressure. And you're going to point the toes away and then towards you. Away and then towards you, nice and slow. You're pretty much grinding that tissue down into the ball. So it can be a bit uncomfortable. You don't go too hard with this one, but there will be some discomfort. Okay, and then we're going to go into an ankle range of motion exercise. So for this one, I find it easier to hold on through the ankle. It just helps me localize the movement a bit better. And you're really putting pressure through, using the chest to place pressure through that thigh. And you're moving the knee side to side to open up as much of that ankle movement as you can. If you want to add another degree of difficulty, you can pull that leg towards you, pull that lower leg towards you, and it'll just help to open up through the ankle a little bit more. So go into all of those tight spots, wherever you find it tighter, more restrictive, then stick to that a little bit more. We're gliding in and out of the position. If you want to hold it a bit longer, you can, but it's quite nice just to pulse in and out. So spend a couple of minutes doing that. And then if you need to, you can do it on the other side as well. So for the dowel walk exercise, find something like a broomstick, something about that thickness, and we're going to literally walk over the dowel. So 1 foot at a time, just gradually moving over. When you find a tight spot or a sore spot, just going to hold on that position, put a bit of pressure through, about a 7 to 8 out of 10 intensity, and hold that for about 20 seconds, and then you're going to continue on as you go. So all of those tight, sore spots, make sure you're holding on those points. Just lift up one leg so you can get more pressure through it if you need to. If it's too sore, you can prop yourself up between the back of 2 chairs, or if it's really, really tender, you can do it sitting as well. So once you come all the way through, come back and do it again. So you want to go through that 3 times right through that exercise, finding all those tight points. we're going to run through a really nice calf stretch today. It's really strong. It's great for Achilles issues or arch issues. You want to hold this stretch for a minimum of 2 minutes. So it's a really strong one. We want to push into about 7 to 8 out of 10 in intensity. So bring your foot back far enough that you get a good stretch out of the calf when you've got your heel on the floor. And I find it a bit stronger to do it from my elbows. You can do it from your hands, but I find if I'm into the wall a bit more, I can get a bit more pressure through that arch and through that Achilles. So you're pushing right down into that heel. You really want to make those muscles stretch. Feel the fascia stretch. Use that imagery that you're opening up through that area. You're lengthening between the heel to the knee. And make sure you maintain that stretch. You've got to maintain the pressure for the 2 minutes. Keep the back straight. Make sure your head and neck is relaxed because you're going to hold it for a while. After 2 minutes, come back up, do the other side, go do the initial side again, and then back to the second side. So you're doing 2 minutes, 2 sets each side. So this is an Achilles eccentric exercise. So you're going to come onto the wall, hands up on the wall, head onto the hands, and coming into a calf stretch position. So your foot is far enough away that you're getting a nice, easy calf stretch. From here, we're going to drop the other foot back a bit further off the ground, and you're going to go into basically a calf raise, but you're pushing that heel up towards the wall. So driving that heel straight up through the body into the wall. Allow the head to move up on the hands. And you're going to go to 8 to 10 of these. These are more difficult reps to do, especially in the early stages of your rehab. So just go as far as comfortable. Don't push it too far, but you want to just challenge those boundaries.